Good morning, everybody. I want to thank Secretary of Health and Human Services, Dev Sangvi, Dr. Frankie Simmons, President of the North Carolina Academy of Family Physicians, Margaret Weller Stargell, who is CEO of Coastal Horizons, and Lisa Poteet, CEO of the ARC of North Carolina, and the many providers, advocates, and legislators who are here joining us today. Medicaid is a lifeline for the more than 3 million North Carolinians across the state. Medicaid serves 1 in 4 million North Carolinians. It is the difference for those people between being able to go to a doctor's office to get better and being denied critical care because it is too expensive. For months, the General Assembly has failed to fully fund Medicaid, forcing cuts to provider rates and leaving people and providers stressed and vulnerable. The legislature's continued inaction left healthcare providers with few options, so impacted families and providers took legal action. And the result of those court cases have led us to today. North Carolina is now restoring provider rates to their September 30 levels, the rates before the cuts were enacted, so that patients can continue to receive the care that they need and deserve. So what happened? What changed? I'll talk about that, but first, some necessary context. For 6 months, the General Assembly was warned by DHHS time and time again about the impending Medicaid funding shortfall, and then without more funding, the legislature would force substantial rate cuts onto healthcare providers. What was incredibly frustrating was that both chambers in the legislature agreed that more funding was necessary. They even agreed on the amount of money that was necessary. But they failed to act in August, they failed to act in September, they failed to act in October, and they failed to act in November. Instead of providing the funding that both chambers knew was necessary, they allowed unrelated budget disputes to get in the way of doing their jobs. Their failure forced these cuts, which are causing real and damaging impacts on people's health and well-being. Their failure is irresponsible and callous, and it's infuriating because all of this was absolutely unnecessary. All they had to do was their most basic and important job: pass a budget. Understand that only one state's legislature in this entire country has not enacted a budget. That's North Carolina's. Just as the General Assembly's failure to act forced not only DHHS's hands on rates, it forced patients and providers. A number of them have taken legal action to protect patients. In the first 2 cases, courts have ruled for the patients. 3 more cases have already been filed, with even more waiting in the wings. DHHS can read the writing on the wall. So the department is restoring all provider rates to where they were on September 30th before the cuts took place. That's what's changed. Here's what has not changed. Medicaid still does not have enough money to get through the rest of the budget year. And that is even clearer now that we're nearly 6 months into this fiscal year, and we can see how Medicaid spending is actually tracking. Without additional funds, Medicaid will run out of money in the spring, which would be absolutely devastating, not only to Medicaid patients, but to the entirety of our healthcare system. Secretary Sangvi will speak to some of those consequences, which we cannot allow to happen. Everyone here and the 3 million North Carolina Medicaid recipients and their families are counting on the General Assembly to step up and fully fund Medicaid. Legislators have said over and over that they will fund Medicaid. It's time to stop talking about funding Medicaid. It is time to start funding Medicaid. It's not about politics. It's about saving people's lives. I urge the General Assembly, come back to Raleigh and do your job. Make Medicaid whole, pass a budget, and join us in standing up for people's health care. I'll now invite forward Secretary Sangvi.
Thank you, Governor. Good morning, everyone. It's great to stand shoulder to shoulder with many friends and colleagues around this important issue. My top priority since taking this job was to increase access, ensure that everyone can have access to quality, affordable care here in North Carolina when they need it. And without additional funding from the General Assembly, this priority in the entire Medicaid program is at risk. Our projections show, as the Governor outlined, that Medicaid will run out of money before the end of the fiscal year. And because Medicaid is such a critical part of North Carolina's system of care, it's going to impact everyone. The entire state is at risk. Without full funding, vulnerable North Carolinians, children, seniors, veterans, people with disabilities could lose access to care that they rely on. We face the prospect of further destabilizing our healthcare system with devastating financial strain on providers. I want to be clear about what's at stake if Medicaid isn't fully funded. Services could be eliminated. Providers could be left waiting for payments that may never come. Clinics and practices, especially those in rural areas where so many residents rely on Medicaid, could be forced to lay off staff and stop serving patients or simply close their doors altogether. When funds run low, providers may have no choice but to limit the number of Medicaid patients they can see, stop accepting new patients, or shut down entirely, disrupting care or decreasing access for people who need it most. For many, Medicaid is more than a program. It is a lifeline. It provides affordable health coverage to more than 1 in 4 people in our state, including those who often face serious barriers like chronic illness, mental health challenges, unstable housing, or limited access to transportation. Cutting off access to care means halting access to doctors, behavioral health services, and prescription drugs for more than 3 million people, older adults, people with disabilities, and hardworking North Carolinians. Rural communities will be hit the hardest if Medicaid funding is not restored. In several rural counties, more than half of the population is covered by Medicaid. And the consequences go beyond health care. Medicaid contributes more than $30 billion to the North Carolina economy. It helps keep rural hospitals open and strengthens the financial stability of providers across the state. North Carolina has worked hard for years to build a fiscally responsible, high-performing Medicaid program, one that is the envy of every state in the nation. And everyone agrees that more funding is needed to keep it whole. There is simply no debate on that issue. Underfunding this program can have serious consequences and put at risk many people in North Carolina. Right now, we need the General Assembly to fund Medicaid in the best interest of our state's health. Let's do what's right and ensure that Medicaid continues to support the health and well-being of everyone in North Carolina. Thank you. I'm now going to turn things over to Dr. Simmons, who can give you a better explanation of what the real impact is on providers.
Thank you, Secretary. Good morning. My name is Dr. Simmons, and I have the privilege of serving as the president of the North Carolina Academy of Family Physicians. I want to express our deepest gratitude to the governor for taking this action today. Medicaid plays a vital role in the lives of patients cared for by family physicians, especially those that live in North Carolina's rural and underserved communities. The proposed cuts would have been devastating, threatening the stability of primary care practices and limiting access for every patient that we serve. Currently, Medicaid accounts for about 25% of patient visits seen in family medicine practices, with that number even higher in rural areas. Without adequate funding, many practices have faced the difficult possibility of closing their doors or laying off staff, jeopardizing care for all North Carolinians, not just those on Medicaid. Even before the cuts that the governor is rescinding today, primary care providers were dealing with long-standing underfunding. Yet the value of primary care is clear. Adults with a primary care physician have 33% lower health care costs. They live longer lives and have reduced instances of cancer, heart disease, and other chronic medical conditions. Legislative leaders have all agreed that more money is needed. We are grateful that the governor took these steps, and we will continue to work with him and the legislature to ensure that the Medicaid program is appropriately funded and continues to serve our patients and our communities. Thank you, and I will turn this over to Margaret Willer-Stargell. She's the President and CEO of Coastal Horizons. Thank you.
Good morning. On behalf of behavioral health, primary care providers across the state, I want to extend my deepest appreciation to Governor Stein for the decision to restore the Medicaid rate cuts. North Carolina behavioral health agencies have been grappling with 3%, 8%, and 10% rate cuts since October that have impacted our staff, our services, but most importantly, the people we serve. Our state already faces serious challenges in finding enough physical and behavioral health Medicaid providers to meet the needs of our fellow North Carolinians. It is important that we restore this funding, and I'm thankful that we have been able to do that for today. But as Governor Stein said, we can't just talk about funding Medicaid. We need to fund Medicaid. Those of us who provide Medicaid behavioral health services struggle to recruit and retain staff to do this important work. And these cuts have exacerbated these challenges. Many agencies have already lost staff, forcing them to reduce services, while other agencies have had to eliminate services, or even worse, some providers have made the difficult decision to stop taking Medicaid clients. The reimbursement of these Medicaid rates, the reinstatement of these Medicaid rates, comes at an incredibly important time, as the holidays can be very difficult for many people during the holiday season who are dealing with behavioral health needs. We are so grateful to Governor Stein for ensuring we can continue to provide the services that are needed to keep our citizens healthy and safe through this holiday season and into next year, and we need for it to continue beyond next year. We now look forward to continuing our work in partnership with the North Carolina General Assembly to ensure that full Medicaid funding will be available through the end of the fiscal year and beyond. Our legislators have shown tremendous support to the people served by Medicaid through the expansion of Medicaid eligibility 2 years ago and providing desperately needed rate increases for many Medicaid services, some of which have not seen a rate increase in over 10 years. We greatly appreciate the ongoing support of the Medicaid services and remain confident that they will make sure Medicaid remains strong in support of North Carolinians. I thank you for the opportunity to be here today, and again, thank you, Governor Stein, for removing these cuts and standing in support of all Medicaid providers in our great state. It is now my pleasure to introduce Lisa Poteet, who is the CEO of the ARC of North Carolina.
Good morning. On behalf of the citizens of our state who happen to have intellectual and developmental disabilities and their families, I want to express our gratitude to you, Governor Stein, for your decision today on the Medicaid rate cuts. We appreciate your continuing commitment to people with disabilities and the supports and services that are so fundamental to their lives, to their health and well-being. Medicaid is absolutely necessary, critical for people with disabilities. A lapse or reduction in Medicaid funding affects people with intellectual and developmental disabilities in a wide variety of ways. Because of the recent Medicaid reductions, we have already seen doctors, who are refusing or reducing the number of Medicaid patients they're willing to see or planning to close their practice altogether. Community-based providers who are cutting services and supports. Direct support professionals who are leaving their jobs because they cannot afford to take a pay cut. And in turn, family members who are leaving their jobs because they have no staff support at home. We're seeing group homes that are planning for closure, leaving the residents with no place to live. Medicaid funding issues are far-reaching for people with intellectual and developmental disabilities. This group has the most numerous and complicated health disparities. People need daily supports through community-based services, residential services, employment services, and many people also need physical therapy, occupational therapy, speech therapy, specialized physicians, psychologists, and many others in the medical field. North Carolina has spent the last 10 years growing one of the best Medicaid programs in the country, and we must do all we can to continue on that path. These services are instrumental in supporting people to become their best and live their daily lives. Governor, we're extremely grateful to you today for this temporary solution, and we pledge and look forward to working with members of the General Assembly to fully fund Medicaid in the new year so that individuals with intellectual and developmental disabilities can get the services and supports they need to live a life like yours, to live a life like mine, to live a life like ours. Governor?
I want to thank all the speakers for your moving, compelling words. It is a core belief of mine that as a state, we should be expanding access to affordable health care, not restricting it. DHHS never wanted to be in this position. We look forward to the General Assembly coming back, working together. We can solve this issue on a bipartisan basis. This has to be done, and we urge the General Assembly to do the right thing, which is to fully fund Medicaid. At this point, Secretary Sangvi and I will go to the adjoining room and take questions. Olivia, anything else?
Yeah, if you are pressed, you can follow Bethany into this room over here. She has her hand raised.
Thank you all for being here.
Thank you.